Welcome to the RollingThru podcast. I'm Teres Ortiz, a trainer, jiu-jitsu athlete, and physical therapy student. This podcast is all about bridging the gap between training, recovery, and performance through a holistic approach to fitness and health. Whether you're a combat sports athlete or just looking to move, feel, and perform better, you'll get insights from top coaches, athletes, and experts on strength and conditioning, injury prevention, and mindset. If you want to train smarter, stay injury-free, and optimize your performance, you're in the right place. Let's get into it. Dr. San Miguel, welcome to the show.
Hello. Pleasure to be here.
Yeah, I'm really excited that you agreed to do this. I tend to gravitate towards people in the field that are, one, very educated, and then educated in multifacets, and which I'm sure you'll get into, but then also kind of live what they preach. And I had a professor who was that way, and then I conveniently ended up working for you, meeting you, following you and what you've done, and kind of been inspired by you and your career.
Yeah.
So I'm really excited that you agreed to do this, and I've been looking forward to. I've been wanting to ask you since I recorded that first episode. I was like, I gotta get Dr. San Miguel on this.
Oh, thanks.
And then
it's so special.
Yeah, I texted you, and then you agreed, and I was like, yes. So is this your first time doing anything like this?
No, I've done podcasts before.
Oh, okay.
Yeah.
Okay. Were they related to the field, or was it
kind of, sort of. I've done some related to disc golf player in my spare time, and I've also been on a couple other like health, wellness, fitness podcasts as well.
Okay, sweet.
Sweet.
So then you can help me guide this thing along.
Yeah.
I'm still relatively getting into it. But
all good. I've only done a handful, so don't think I'm beginner expert over here.
Yeah. All right. So first, if you can introduce yourself to the listener for someone that doesn't know Dr. San Miguel, help them get a better understanding of who you are and what you do.
Yeah, of course. Well, I'm Dr. Alberto San Miguel. I'm from here in San Antonio, Texas, born and raised. Have kind of a very interesting background for what I've done in my professional career. So I started out actually as a history major, and that's actually what my bachelor's is in. And so not a lot of people know that, but I started there and was working in a museum archive, ironically for a medical museum, which was always kind of cool. So I just spent my time in a giant concrete box organizing documents and old mobile hospital information. And while I was in that setting, I was always doing personal training on the side. I've been fascinated by fitness, performance, all of that my entire life. And so doing personal training on the side was just an extra way for me to make cash and just really stay involved with that passion. As that started to grow, I was finding that I had to make the decision, do I go more into personal training and give up what I was originally trained to do for my degree? And so I eventually just went ahead and went full plunge into personal training and started out for just a general box gym, doing my training there, and at the same process was getting my strength and conditioning certification. So I have the CSCS from the NSCA, or Certified Strength and Conditioning Specialist from the National Strength and Conditioning Association, for everybody that doesn't know all the alphabet soup that's all related in these different settings. So I did personal training for about 6 or 7 years. I even did some time actually as the lead trainer over at University of Texas San Antonio for their rec center. So a large part of what I did there was mentoring kinesiology students, exercise science students that were wanting to go into personal training or these related fields. And so I kind of acted like a mentor to them, which was a really cool setting. Eventually, I got to the point that I was mostly working with populations that had already dealt with some sort of injury, and either their insurance was not covering it or they needed something else beyond the standard care that you would get in a physical therapy setting. So the scope of practice differences between what a personal trainer can do and what a physical therapist could do, I kept running into that barrier. And so I went, you know what, might as well just go to school for another 3 years or however was it, like 5 years I think it took me to get everything I needed. But I went, I might as well take the additional time so now I can deal with both populations, be able to work on the performance side and on the treatment side. And so fast forward a little bit more, and now here I am as the director for outpatient orthopedic clinic in San Antonio, Texas.
Yeah. Yeah, and that's how we met. I just finished my undergrad and knew I was going to take a gap year to apply to schools. And my sister's here at UT Health, and that was my main number one school to get into, and I ended up getting there. So
Congratulations, by the way.
Thank you. And I knew I wanted to live in San Antonio, and I was going to live with her and find a place to work. So there was a couple clinics I was interviewing at. And one of the things that kind of attracted me here was whenever I was interviewing, they mentioned the kind of collaborative approach to treatment, and I kind of saw that as I worked here too, with you meeting with some of the other clinicians here and kind of discussing patient treatment. And I've been in other clinics. I've worked in another smaller clinic when I was in my undergrad, and I hadn't seen that. I hadn't seen that with that much. I hadn't seen that intentionally. Sometimes the PTs will talk in passing, like, "Oh, so and so is doing this and this and that. What do you think?" But this was like you guys schedule it, you guys discuss it at length, and I've sat in on some of those discussions, not at this location, at a different location, but under the same company, and I was very impressed by that. And I thought, and then also you guys paid me a little bit more than some of the other places. So I was like, "Oh, come
just
here.
a little bit, just a little bit."
Yeah. But with that being said, I know you talked about kind of your non-traditional path to becoming a physical therapist. And with most people, most PTs that I've met, most PT students, I got into physical therapy because of my own injury. And that is like 90% of the field. Fortunately for me, that's not my case, but I know for you that is kind of your background.
Yeah, and that is very much what happened to me. I've always been involved in sports and just being active outdoors and all of that, and so personal history is that I've had 5 surgeries on my right knee, and I've also had a bilateral hernia repair and a bunch of other stuff that I've been beat up over the years. But for me, I was always fascinated by how we can get people better, get them back to high level activity, and not just physically, but also mentally and psychologically prepared to do those activities. We contribute so much to that as physical therapists, or in the health and wellness realm as well, helping people build that confidence in themselves. And so I had been through physical therapy so much that when I was doing the training, I was always thinking in the back of my head, how do we get personal trainers to collaborate in this same regard that I'm seeing people with these components? How do we add to it from the strength and conditioning, the performance side of things? And so that's really where I got my initial start for going and getting my strength and conditioning certification.
And earlier I referenced the cross education, right?
Yeah.
The PT, DPT, CSCS. How has your experience as a trainer, and then from your education as a DPT and your education as a CSCS, how has that translated into whether it's your own training, maybe how you've trained others, as well as the treatment that you do here?
The big components for me are both sides of the profession are all based on movement, the science of movement. It's your biomechanics, your kinesiology, the lever arms, and all of those core classes that everybody tends to gloss over because they go, yeah, this is just my prereqs.
Yeah.
But those things we can't undo the laws of physics. Mm-hmm. And so keeping those things in mind is always what's really, really important, and understanding that those concepts look different for every person. We're all built a little bit different in our shape, our size, our injury history, all of those things. And so evolving my own training over the years for what I'm hoping to do with my body, but then also adapting that to what people need for their goals in life. I have plenty of times where I'm treating a patient with an ACL reconstruction that's trying to get back to master's level CrossFit competition. And then the next hour, I'm treating a 95-year-old woman that just wants to be able to get up and down from her bed safely and walk along with her grandchildren when they come to visit. So I look at both of those goals as performance. It's just a matter of how in depth do you go into achieving that level of performance.
And some people I've met that are around my age that are trying to get into PT school, they kind of gravitate towards, obviously, ortho, 'cause that's like the most popular, but always wanted to work with athletes, because that is kind of the fun part, right? You can be a lot more creative and a lot more intense with some of your training, or some of your treatment. But I agree with you in that it is still performance, right? And it's still the neural recruitment is similar in both movements, right? For that individual, the intensity level, the RP is probably similar for that 90-year-old woman getting out of bed as it is for the CrossFitter doing a snatch, right? It's still difficult for them. And from what I've seen, and you'll probably agree with this, is even when I was here working, and we would go from 1 hour we get that CrossFitter, the other hour basketball player with 20 ACL, the other hour it's somebody's grandmother here that's recovering from a fall. Is what I liked the most was that when the patient really wanted to get better and they really cared and they were very passionate about wanting to try their hardest here so that they could try their hardest out there and not demolish their body. That's when I was very invested in making sure I'm doing my part and doing my best. And that's not to say that when someone didn't care, I was not caring either. It just took more effort for me to care, right? Unfortunately. But yeah, and I'm sure you've probably seen something similar to that, and that it is always easier to treat someone whenever they care about their own well-being, and it's not always, everything hurts, and that is kind of the downside of physical therapy, I guess. And how do you deal with that in that you are I don't want to say that we'll call it, you're the head of the snake here, right? And that you are the one that everyone turns to whenever things go wrong, essentially, or whenever someone has a question, they turn to you. And I know I did when I was here. So for you, how do you approach helping someone that isn't always so motivated to help themselves?
That's probably the hardest part of our job. Treating people that care about themselves is great. Usually that mentality goes a lot farther than anything we can do physically, because that intrinsic motivation is going to drive everything internally to the positive direction that we want. There's always going to be that drive for compassion and empathy in physical therapy and wanting what's best for someone, but you can't, just like the old adage, you can lead a horse to water, but you can't make them drink. You have to meet people where they're at, and some people just aren't ready to take that step for themselves, and we have to be okay with them not wanting help and just letting them know the resources are available to them. So I'm usually talking with them in a very honest way, but also very respectful way, and just letting them know, this is where I think your plan of care needs to go. I know these aren't necessarily the things that you want to be doing at this time, but these are available to you. Whenever you're ready to get started with it, just let us know. And then if they walk out the door and never come back, I've come to accept that. If they come back 2 months later and say, okay, I'm ready to get started, then we jump right into it. Because we're dealing with people on such a personal level, usually at the worst part of their lives, or some of the worst times in their lives, we have to recognize that they are not their authentic self. Pain changes the way that we perceive ourselves, the way that we interact with others. The hardships around our daily lives that it creates changes the way that we interact with others. And so that can be draining as a physical therapist, but recognizing we're here to help people. Let's help the ones that are ready to do so. Let's extend an olive branch to the ones that aren't necessarily open to it, but we don't have to force it on them.
Yeah. And I remember not the motto, I guess the principles of the clinic. There's
Our core values.
Core values,
yeah.
Yes. And it was like a list of things. And I remember one of the things on there was what you said, is that pain can make someone not their authentic self. It can kind of make, it can kind of bring out I don't want to say the ugly, but it can bring out someone's negative, right? And that maybe their attitude isn't always the best, and that can be sometimes hostile to someone trying to treat them, right? And but yeah, earlier you were talking about your own injuries and injury. Anyone that wants to achieve anything athletic performance-wise is going to most likely run into an injury at some point in their life, whether it's an ankle sprain or a torn ligament of some kind, something significant, something that's small. With that being said, injury prevention is a very common hot button word that people like to use, whether it's to claim that this exercise is great at preventing injuries, this program is great at preventing injuries. And there's a lot to be said about injury prevention. And there's a lot of people have a lot of differing opinions. And I know you're probably familiar with Dr. Mike Israetel, and he has a take on it of, there's two sides in the academic kines world, and one side is we want to get an athlete as big and strong as possible to, and big and strong in all ranges of motion to prevent injury, and they'll be so strong that they keep their body safe and they keep those joints safe and building strength around joints. And then there's another side of the coin that is injuries are random, and no matter what we do, we can't prevent them. And I know you've probably heard this as well, in that whenever you ask a PT a question like what I'm asking you right now, they're always an answer. It depends.
It depends.
It depends, right? And I heard that debate, and in my mind, I was like, it does depend, right? Because I know in my personal life, when I was my biggest and strongest, I had a really nagging hamstring injury, and I know I also had a lot of feet injuries but that's because I was 215, and I think I had like a 39-inch vertical at the time, and so I'm producing power for me, which was as elite as it gets for me, and I was my heaviest, so maybe I did a poor job in building my strength, and that my body wasn't ready for those movements, right? Or maybe ready to produce that amount of force. So to someone, that example would be, even though I was big and strong, maybe it was random and I still hurt myself, right? So where do you fall on that side of the coin? Maybe it is it depends answer, right? But where do you fall on that side of the coin?
I am, first and foremost, I have my own little pet peeve about the buzzword of injury prevention. There's no such thing as injury prevention. Our bodies are constantly changing. Things are always happening, whether we want them to or not. So I always use the term injury resilience. Should your body be exposed to some incident or unexpected force, how well is it going to resist damage from that incident? Because it's just like saying, how do I prevent car accidents from happening? Well, the easiest thing is to get rid of cars. Otherwise, we're always going to have them, right? There's no stopping that type of thing from happening. So I am more on the side of the more we train the body, the more we load it appropriately for a given activity, the less likely we are to be affected by something unexpected. And so when I was doing personal training, I built programs according to that idea. When I've worked with my patients now, I work according to that idea as well. Is how do I get them as prepared as possible? And then if there's any sort of specialty work that needs to be done beyond that, well, let's send them to a specialist. Especially now for myself, being in this outpatient orthopedic setting, I still use a lot of my strength and conditioning performance principles, but I'm by no means a sport specialist. If my athlete is 6'5" and I'm 5'6" ¾ I don't see things from the same perspective that they do. Let me send them to somebody that's trained to deal with sport-specific basketball or whatever, or volleyball, whatever it is that they may do, and then we collaborate together. So I think that is an important component as well on that spectrum of random versus get as big and strong as possible. Is, well, you have to collaborate with everybody involved in that to best prepare someone for the unexpected. And there's so many interesting underlying factors as well. Like for myself, I've had the 5 knee surgeries, but it wasn't until later on in my life that I was diagnosed with an underlying hypermobility condition. And so things that would normally hurt other people from range of motion wise don't affect me because I can get into that dangerous motion and my body goes, that's fine, this is how we stretch this way anyways. Versus for my injuries, I've had all this cartilage damage in my right knee. And because of that natural laxity in my joints, I've just worn away the cartilage faster than most people. So it's kind of like a blessing and a curse. So my injury prevention, injury resilience really focuses on positional awareness and controlling joints in non-standard directions under light load. And so I've also humbled myself and realized that as I go into the latter half of my 30s now, I'm not reaching to be a professional athlete or anything, so I don't need to train like one. It is more important that I take care of my body now, so that way I can make the most of it later on in life. So same thing with my patients coming in. Gets very common. You remember the stories. They're like, oh yeah, I used to be an all-American athlete for football or blah, 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 blah. And I went, well, sir, you're 55 now and 100 pounds overweight. Where do you think that all-American athlete is going to help you out at this point in time? And then they kind of have the blank stare of, I didn't think about that was, 40 years ago.
You mentioned your main approach to injury prevention is that full range of motion, being in deeper ranges that they may otherwise not be in under a light load. And that ideology has become pretty popular as of late, like in the last 5-10 years, I would say. And I'm not that old, so maybe it's even older than that. But from what I've looked back and seen, it's become very popular in the last 5 or 10 years. And it's been popularized by a countless amount of social media influencers, people on YouTube, and probably most popular would be like the knees over toes guy, Ben Patrick.
Yeah.
And earlier I was talking about how I was speaking with Phil DeRue, and one of the things he does in a lot of his programming is what's called FRC training. And I'm sure
the functional range conditioning. Yeah.
And that is kind of, even though that concept outdates Ben Patrick's time on the scene, but Ben Patrick references stuff from like the 70s and 60s, right? And so this all of this has existed for probably 100 years. It's just a matter of, did this person write it down, right?
Even beyond that, you look at the early or the late 1800s, early 1900s, when this was called physical culture. You think about the old time strongmen and with their big mustaches and all of that. You look at the way those athletes were built and how symmetrical and well distributed their muscle mass and build compared to now, and athletes being so highly specialized. And I think that is the big change that has come. You see these DeRue, Patrick people coming in, and they're kind of bringing back these generalized concepts of general physical preparedness is better for the masses. Specialized training is for specialists. Leave that for the athletes. Not that to say that people can't get involved in those things themselves, but if I would love to be able to dunk, but
you were close at one point, right?
Back in high school, like 20-something years ago. But do I need to be able to dunk? And is it worth it to put my body through the training to be able to do so? How is that going to help me with the rest of the things that I want to do in my life? So that is how I view my personal training, or my training for myself, but then also how I view my plan of care development for my patients. What is it that I need to do to get this person capable for their daily life and their daily activities? If there's anything additional to that, then we're going to work on those.
Yeah. And back to the like FRC concept and like the knees over toes concept, and I've looked into FRC training, and I've followed Ben Patrick and some of the stuff he references, and I've looked at some of the stuff he learned from, and I find a good chunk of it pretty valuable to the right population, and that's the main thing, right? Is that sometimes people see these things and they see him doing like a sissy squat, jumping off a ladder, landing into a sissy squat. And it's like, okay, that's
Sensational.
yes. In what world do we need to do that, right? And what is, the memes are like, what are you even training for doing that, right?
Yep.
And that's a very extreme end of the spectrum. But people see things like that and think, oh, if I want my knee pain to go away, I need to train like that.
I need to do that thing. Yep.
Yeah. And so then some people reference, oh, well, Ben Patrick has led to thousands of more people getting injured. But the same can be said for anyone that shares their opinion or their exercise program.
Exactly.
Right?
Same thing could be said for P90X.
Yeah, exactly.
The idea behind it, fantastic, but there's the level of scaling is not immediately apparent, and so of course people, I'm a former All-American, I could do this, and they go try something, and their body goes, hey, we haven't done this in 30 years, we should probably dial it back. No, I'll be okay, and then all of a sudden there's an injury.
So personally, I use a lot of the FRC concepts and a lot of the old stuff that Ben Patrick's referencing that I'm forgetting the names of. But I use a lot of that in my own training for the past 4 years, and certain populations depending on the client if it's appropriate or not. With that being said, one of the things I was talking to Phil about that I want to get your opinion on is there's clips constantly circulating around on the internet of someone behind a camera asking, like an orthopedic surgeon, what's one thing you would never do? And they're like, squat below 90.
Yeah.
And then there's clips of, another ortho saying, you should never lift with a bend in the spine. Everything should be braced constantly. And those are very old school thoughts, and they've been around for decades. And if you went to the standard program online, they'd probably teach you that way. Now, again, population, and the answer to this is probably it depends, but for the general pop, what is your opinion on squatting below 90? Because you referenced your hypermobility and how that maybe has led to cartilage damage, or that did lead to cartilage damage. So what is your opinion on squatting below 90 or ass-to-grass squats, or something as intense as like a Jefferson curl for the spine, or maybe lifting with a curved spine in general?
Yeah. The way that I think about it is those things are going to happen regardless. Those are components of everyday life. We just may not put two and two together. And in terms of the squatting, there are cultures that mostly of East Asian or Southern Asian nature that squatting is a part of their everyday lives, and their knees over toes, butt to ground, as like picture perfect as you can imagine. And the number of knee problems reported in those people is much. It's actually the hips that they've seen more problems. But the body is very resilient. It's going to adapt to the activity that we put it through. In our current culture, deep squatting is not a everyday necessity. We're not digging a hole to use the restroom. We are sitting in a chair at 90 degrees in our knees and our hips for 8 hours at a time. I think it's more the lifestyle of our culture that is making it difficult to do those things. Otherwise, another way I think about it too is that, as far as I know, we haven't evolved very much in the several hundred years. And so if that was the case, we would only have 90 degrees of motion at our knees, 90 degrees of motion at our hips. So that way I am sitting as good as I possibly can, because I am anatomically designed to do that. Yeah. We're anatomically designed to have that full motion, get that knee, get that hip in position. The body is safe in those if we train it, if we adapt to it. The same thing for lifting with a curved spine. We think about the idea of perfect movement, but nobody has perfect movement. There's plenty of times where you wake up and you forget to set your alarm, and you go, oh no, I'm late for work. And you throw yourself out of bed, and you're there about as rounded out as you could possibly be, and you're perfectly fine. Or you drop something and you try and catch it, and you're leaning over, you're twisted, all of that, and you're perfectly fine. We expose our body to these directions, movements, forces all the time, But when we overthink them, that's when we are more likely to get exposed to an injury.
And you said, overthinking them is what's most often going to lead to injury. And I agree with that. And I've kind of referenced it as this over-analysis of movement, and that's the overthinking of, and that point you made is great about if we weren't designed to squat below 90, we wouldn't be able to. And I agree with you on that. And I think if we weren't, I'm a really big fan of getting the most out of whatever your body can do, right? And we were all born with some capacity of we'll call it athletic performance. And because any movement we'll call athletic performance. Earlier we were talking about a 90-year-old lady getting out of bed. That's athletic performance for her.
And
right?
I doubt that she has the straightest spine
Yeah.
possible and the bends in the hips. She's probably already kyphotic from changes in her spine as she's aged.
Yeah. And so I do jiu-jitsu, and I try to give as many tips as I can relative to combat sports, because I feel like the sport in general is kind of late to the show, as like basketball has become very almost overanalyzed with movement. Football, same way. Golf. I feel like combat sports, everyone thinks, bite on the mouthpiece, suck it up, and take it up and go out there, right? And with that being said, like I said earlier, if you look up how to do a back squat, how to do any movement, it's always kind of, that bracing of the core, locking the spine, rigidity of the spine, perfect movement. And combat sports is the complete opposite of perfect movement.
I was going to say, if you go for a throw and your back's rounded out, you don't say, hold on, let me straighten out my spine real quick before I throw you over my shoulder.
Yeah, exactly. and that goes, we were talking about injury prevention, and depending on the sport, some sports are more dangerous than others. And really the explanation for how likely you are to get injured in a sport is really the variables around the sport, and whether it's the variables in your movement or the variables of someone else on you, some kind of external force. Combat sports is as dangerous as it gets in that there's a million variables, right? And with that being said, I'm thinking of the curved spine conversation that we're having, and something like, are you familiar with what a Granby roll is? Have you ever heard of a Granby roll?
The term sounds familiar, but I don't recall.
It's very popular in wrestling. It's kind of like a side roll, but you're rolling along your neck and shoulders.
Yes, I know what you're talking about now.
And there's a lot of transitions in jiu-jitsu, and wrestling is extremely popular. There's a lot of transitions in jiu-jitsu and submissions and escapes where you need to be able to do a Granby roll. And I know when I started jiu-jitsu, I couldn't do a Granby roll. I didn't have that kind of mobility in my T-spine and in my neck. Now I can do them very well. And if I showed an ortho, hey, watch me do this, and I roll over to them in a Granby roll, they might have a panic attack watching me do that, right? Now, if I show them that and I have a 200-pound man on top of me and I'm hanging on to them, as I roll them on top of me in a Granby roll, and I have probably more than 200 pounds of force on my thoracic spine as I roll, they might think, they might see money signs because they know I'm going to go see them in a couple of years, to them, right?
Yep.
And in the UFC, whenever you see injuries as it relates to like a Granby roll, and in jiu-jitsu too, a lot of it isn't these vertebrae injuries and these spine injuries. The most common injury from a Granby roll is normally like a rib cartilage injury. But that's because they're so, in my opinion, that's because they're so well trained and strong in that range of motion that the spine is not even compromised. Most of the time, the spine isn't compromised in that range of motion. That it's the other structural things surrounding the spine or surrounding the torso that aren't prepared for that movement, right?
Yeah.
So I think that's the best example of how strengthening something that we think is so fragile like the spine can become stronger than the things that surround it.
Yep.
Right?
And to delve into that a little bit deeper, what's really fascinating in that is actually how our nervous system functions. So our nervous system is very sensitive to anything that is considered novel as far as movement or afferent information sensation goes. And whenever it has that novel information, it gets very, very protective. And the way that it does so is by muscle contraction. So whenever we are learning a new motor skill or exposing our body to a new pattern of movement, muscle tension is very, very high. And if we are locking up all the structures around a joint, it's not going to move. So what's going to get injured? Everything inside the joint. The when we get exposed to unexpected forces, a car accident, what's the first thing we do? We grip onto that steering wheel for dear life, push ourselves into the back of the seat as hard as we can, locking everything up, and then what happens? We get a whiplash injury because nothing is moving except our brain rattling around in our brains. And so to come back to the combat sport example, you're constantly exposed to unexpected forces, and so your body has adapted to the majority of those sensations, and so even though you're getting whipped around, you're still relaxed. Your body is appropriately contracting support structures where necessary to move through that unexpected position. So like you say, it's not the movement itself that is dangerous. It is usually the level of the force that gets applied. So the same thing in our daily life. People sit in a chair all the time. They start to have this little shrimp posture from sitting and working on a computer. And then they go to pick up something from the ground and, oh, I threw my back out. Oh, I slipped a disc. Well, they aren't used to that movement. Their body doesn't know how to put on the brakes or let off the brakes of the muscles in those structures to allow them to do it efficiently. So you can think of any great number of examples. Tell me a mother that perfectly picks up her child every single time from the ground because they're like, no, gotta be careful there. Or the person that goes, nope, I can't let my knee bend past 90 degrees to get down this set of stairs. Our body is meant to move in all of these directions. The more we expose them to them, the better we're going to be able to perform them.
Yes. Yeah, and I agree to that. And you reference wanting to expose the body to these controlled variables to prepare it for the uncontrolled variables. And the perfect example of that is, training in the weight room is almost as controlled as it can get. And it's almost as, if done correctly, it can be the safest of any sport. So that's the perfect time to kind of take the training wheels off a little bit and expose yourself to a little bit of vulnerability in the movement. Maybe it's something I do with a lot of people is whenever I get beginners is the standard trap bar deadlift. It's really easy to teach. It teaches a proper movement. Whenever you're trap bar to back squat, it's really easy. It teaches the hinging at the hips, bending at the knees, straight up and down, right? I think it teaches a good movement pattern. Almost a perfect movement pattern like we were talking about earlier. But if we want to take the training wheels off a little bit, flipping the trap bar upside down forces 4 to 6 inches, depending on the trap bar, 4 to 6 inches deeper in the squat. So now it requires a little bit more mobility, and obviously we're going to lighten the load for it. But as long as and for them, I'm not exposing them to the curvature of the spine, right? We're still trying for that perfect movement because they have no experience in training, right? So it's kind of the progressive overload concept, and we're still really early in that for most of these people. But it forces them to get a little deeper in the squat, getting comfortable in that range of motion. So I'm kind of stealing concepts from like FRC training, from some of the old school mobility work. And that's another thing I wanted to talk to you about was if someone goes online and looks up injury prevention, probably one of the first things you're going to see is mobility work, right? Mobility work is going to prevent injury. Now, when people think mobility work, they always think stretching, and they think touch your toes, every static stretch you can think of, right? And mobility work is much more different than, for one, flexibility. But mobility work when combined with strength training, is kind of like what we were talking about earlier, how you said getting in those ranges of motion under a minimal load, but is still tolerable, but still challenging for them. That would be an example of mobility work, right? So for the average Joe that wants to prevent injury, or for the average weekend warrior that goes to 2 jiu-jitsu classes a week or does CrossFit or whatever it is, if they want to prevent injury, like you said, doing that combo of strength training and mobility of working in deep ranges of motion, probably in compound movements, would you say? Mm-hmm. So maybe it's a front squat going deep, maybe it's a back squat, maybe it's getting a wider grip on a barbell and getting into a deeper bench, or dumbbells and getting into a deeper bench, right? do you have any, I mean, you do this every day, so you definitely
Yeah.
have a ton of experience, but the examples I'm using right now, do you have any other examples for someone that maybe is trying to work on injury prevention as they age or as they continue their journey?
Yeah. So just like training per performance, training for resilience, you're going to use progressive overload. That is the underlying concept for a lot of what we're talking about. And so in reference to this whole idea of stretching first and foremost, I am not a big fan of stretching because of the misnomers and underlying connotations that it lies there. Stretching definitely has its place. If I have somebody with a total knee replacement and their knee is very stiff, yes, I need to stretch them because I need to get a certain range of motion for them to function in their daily life. If I have a Olympic lifter, I am probably not going to stretch them because I need their tensile tissue to be as strong as possible. So, with my little soapbox here, people always bring up the idea of, oh, I want to be flexible, I want to be able to stretch as much as possible. Well, when you look at the true physics definition of flexible, it's how far a tissue goes before it permanently deforms its integrity. Mm-hmm. And so I don't want to do that to my body. I'm already hypermobile. I don't want to deform my structural integrity any farther and expose myself to risk. Or people that say, I'm stretching my hamstring, and it's like, well, how much do you really need before you injure your hamstring or anything of that? So that's just a little soapbox of mine, is that
that's a good point.
When we say flexibility, it's a misnomer. What we are learning is how to control a motor pattern and maximize muscle function in both its fully lengthened position, mid-lengthened position, and fully shortened position. If our muscles are able to function across that entire spectrum, we are getting graded exposure to forces across the different tissues. What would cause a muscle to become injured is different from what would cause a ligament to become injured versus a joint versus connective tissue versus nerve. And so all of those things are constantly working together to allow us to function. Our mobility work, our injury prevention, resilience should be working on all of those components as well. And that's where, how I said before, that for my training, it is exposure to different ranges of motion. And I said light load, really, that is saying start light load, yes. Add load progressively as your body is able to manage it. And the same thing applies for this injury prevention. Really what people are learning is, how am I building my body awareness in each of these positions to best support the structures within that area. So the same applies even with our strength and conditioning, right? I'm not just going to go, okay, this person wants to deadlift 400 pounds. Well, let's go deadlift 400 pounds. If they don't even know how to lift 100 pounds off the ground, well, that's where we need to start. And then we build up from there. And then we do our mobility injury prevention work according to the demands of that activity. And even program design contributes to that as well. When do we deload? When do we change our set and rep schemes for hypertrophy versus ligament tendon integrity? Those are all going to play a role as well. So these mobility, as we said, mobility injury prevention, it's going to be a multifaceted approach. There's no one right way to do it, but there are a lot of good ways to contribute to it.
Mm-hmm. You made a lot of good points there.
Yeah.
This is why I wanted to come talk to you. That was great. You said you were talking about phasing, right, for programming. Mm-hmm. And I'm sure you're familiar with Louis Simmons and Westside Barbell and mm-hmm. all their work. Mm-hmm. And one of Phil DeRue's mentors was Louis Simmons, and at Westside Barbell they popularized the Conjugate method. And that was also, we were talking about lifting being one of the safer things you can do because it has minimal variables, injuries can still happen. And they had that issue at Westside Barbell, so they created the conjugate method to kind of get ahead of the curve, and that there was this cycling of exercise selection to prevent the overuse injuries, right? Which is probably the most common thing that happens in a gym or in a weightlifting and a competitive powerlifter, we'll say. But yeah, that was good.
Yeah, even in physical therapy, we deal with repetitive injuries.
Yeah.
I deal with people that non-specific low back pain, mid-40s, sedentary lifestyle. They're all coming in with wrist pain, mid-back, and lower back pain. Because what do they do all day? Sit in a computer, type, hunched over like a shrimp. And so they are in sustained postures that are causing an overuse injury. Not the same extent as Westside Barbell, people squatting 800 plus pounds, but the same idea. They were exposing repeatedly to forces beyond the optimal positioning of a joint to or tissue, and that's where these injuries are arising. So I have to phase my patients as well. If they sit in a chair all day, I'm not just going to get them up and go, okay, we need to work on your hip hinge and how to keep your glutes working and everything. Let's go pick up 100 pounds. I'm starting with a stick, and I'm teaching them how to lean over from a chair. Because the same idea is applying. I'm deloading the injured tissues, and I am loading the support tissues as much as possible to get them better. Same thing with high-level athletes. You are addressing the injured tissue. How do we get everything else to support it?
And so to answer the question of like, what can the average Joe do to train, whether it's to prevent injury or just train for longevity, we'll say. Kind of to summarize what we talked about was, the mobility work, but combining strength and mobility, like working in deeper ranges of motion, starting with a light load, progressive overload, as you would any other movement. That's probably, would you say, the biggest factor for most people?
Yeah.
Is that approach to training as opposed to the, lifting like a bodybuilder or lifting like a powerlifter?
So, and this idea of general physical preparedness. The majority of people aren't athletes. We don't need to train like athletes. We need to train like humans. And there's the two people that I really enjoy from the strength and conditioning realm that talk about those concepts are Dan John and Alwyn Cosgrove. That the way they put it is, everything's going to work until it doesn't. If someone is so detrained sedentary, anything is better than nothing until that thing is no longer works. So if someone says, I'm going to get back to being a high level performance, okay, cool. Well, you sit at a desk all day working, and then you go home and watch Netflix. At the end of the day, that person's going to see more benefit by adding 5 minutes of walking every day to their daily routine. They're going to have significant health improvements as a result of just that one activity. But eventually, that's not going to be enough. The body is going to adapt. Okay, well, now we're going to work on adding squatting to that daily regimen. Okay, well, we'll start 5 squats and then progressively increase until that no longer works. Now we have to add weight to the squats, or we go single leg for the squats. The body is always going to adapt to what we do, and so we should be in constant pursuit of improvement, but we don't have to improve on everything all at once. And I think that's another underlying component that gets missed for this general physical preparedness. What social media shows us, these are the 10 best exercises that you need to do to whatever your goal is. And people think, okay, I can only do those 10 exercises, but they never tell you, when do you start this exercise? When do you stop this exercise? When do you combine them together into a single day's program or across a program? And that's what leads people to injury more often than not, or dissuades them from trying to get better. They go, those exercises look really hard. I really don't want to do them. And then they stop. Altogether. And so I think that we are, to divert a little bit, we as a society have gotten so used to instant gratification. The development of the human body takes time for performance, for health, anything of that sort. And we want instant results. I want it now. I want it now. I want it now. I want my six-pack abs right now. I want my total knee replacement surgery to be better within a week instead of the 6 months. The helping people understand that all of these things take time and there's going to be bumps along the way is going to do more for them than here's what you need to do to get better. And setting that realistic expectation is going to give them more perspective on how they should be perceiving their improvement.
Yeah, and I see a lot of that at my job as a trainer, and that I see people coming in all the time inquiring about training, and I ask them, okay, how many days are you trying to commit to the gym a week? And like, I can do 5. And I say, okay, well, what do you do for a living? Oh, I have a desk job. Okay, when was the last time you were in a gym? When I was 17, and they're 45 now, and it's like, that's like, I don't want to tell you to not come to the gym, but those 5 days aren't going to look all the same, and that probably 3 of them when you start are going to be you coming in and doing 15 minutes of walking and 1 exercise and calling it a day. It's just the routine stays the same for them, but they hate hearing it. And I always have to explain to them I'm trying to meet you where you are, and right now you're here. And that's always a tough conversation, and I'm still figuring out how to approach people with that info, because they don't always want to hear it. They always think, like you said, they want the instant gratification, and they think more right now is going to lead to more results later. And that's not the way our bodies work, really. And that if you do more right now, you're drinking from a fire hose, and you're more likely to break right now than you are to do anything if you overdo it. Which, then you got to re-listen to all of this and all the injury prevention we talked about, and injury rehabilitation. So real quick, we talked a lot about injuries. Let's touch on a little bit of a little bit beyond the injuries, a little bit of strength training, right? So for the average Joe, or for anyone that wants to get stronger, move better, perform better, be able to throw someone that's heavier than them, whatever their goal is, right? And as it relates to jiu-jitsu or combat sports. For someone that has a full-time job, a family, and still trying to train and be as good as they can, and they can commit 1 day a week, 2 days a week to the weight room, for you, in your opinion, how much benefit can they get out of that? What should those days be looking like? Because I have my opinions on that, and I have my suggestions that I've talked about publicly, on this. But in your opinion, how should that look?
For me, it should, number one, activity, whether you're training, recovering, anything, go for a walk, go touch grass. Literally expose yourself to the elements. That is what our body is designed to do, so do it. There are so many health benefits, mental health benefits, psychological benefits to just walking. I've seen people lose 20 pounds just from starting a walking regimen and changing nothing else in their daily life. I've seen people come up with genius ideas because they went for a walk to clear their head. I've had people tell me their back pain got better when they went to go check their mail and they walked across their grass barefoot. The body has an amazing ability to learn and adapt to sensory information to make itself better. And walking is the easiest way for someone to start without any equipment. Same time commitment as getting in the gym or anything, just get out and walk. So that's where I always start with my patients, or with, when I was a trainer, clients. And as far as a, resistance training regimen, we'll call it, I always start with compound movements, get the body to learn how to work with itself. Combine joints, combine awareness of postures for overhead pressing, for squatting, or as well, the cardinal movements, push, pull, hip hinge, or hinge, squat, carry, all of that. Those you can build an amazing training program off of just those principles and progressive overload. So starting with body weight, starting with a lower body regiment, starting with a upper body regiment, and then progressing to combinations of those things. There is no wrong way to combine those activities. And so for people that are just starting out, and like I said earlier, it's going to work until it doesn't. And then when it doesn't work, we make a change to it, whether it be sets, reps, intensity, time for rest period, all of those components.
And the
I know it's not the most specific answer, but it's again, from where I come from, the majority of people just need to do something, anything, and it's going to improve their daily life, their performance.
Yeah, and earlier I was talking about Dr. Michael Zutel, and he kind of loves to shout out the saying of minimally effective dose, and the maximum effective, like recoverable volume.
Yeah,
I butchered that, but you get the point.
Yes.
And you said something similar to that earlier. And so one thing that I was preaching, and I've preached to a lot of people that have asked me that question, is, whatever you're doing right now, and it's always basically nothing for most people. And I was like, what'll give you so much benefit is almost anything.
Yep.
Is that you can walk into the gym, throw a med ball against the ground, against the wall, slam it, 20 minutes, leave, and you're going to do that once a week, and that's more than you've been doing, and that's beneficial. And some people really disagree with that, and that they'll tell you, well, the most effective way to get strong is this amount of volume and this training program, and the best way to get big is this amount of volume, this training program. And that's a different conversation. Hypertrophy and strength training have two different sciences behind them, two different amounts of volume that are effective.
But people always ignore the science that it takes a minimum of 4 to 6 weeks to see a neurological adaptation before you actually have any sort of muscle hypertrophy that takes place.
Yes, yes. And I referenced some studies that I don't have memorized on top of my head, but they're online, and I have them on my Instagram if people want to look at them. But they essentially found that for strength training specifically, and they were comparing 1 rep max over, I think it was like an 8 to 16 week span, and it was 3 studies. And it was that, and 2 of them were looking at trained individuals, which is when most people point to, like right now we're talking about beginners, we're talking about really novice people that have minimal experience training. So they're more likely to see greater results than someone who's trained, right? But looking at a trained individual doing as little as 2 working sets, as little as 1 working set, as little as 15 minutes of training, that was about 5 working sets, I think. And how those volumes, allocated over time, and if they were able to see gains in their 1RMs, and almost everyone did, and sometimes it was really significant. And that was and they were controlling variables. They were limiting, other training outside of that. It was basically in a lab. And I use that whenever people ask me, oh, what can I do? I only have 2 hours a week. And it's, you can do anything, really. Yeah. It's anything is better than nothing. And earlier I talked about the over-analysis of movement and the over-analysis of training. And for someone that wants to start hitting the gym or losing weight or feeling better, whether it's for a sport or just their sport of life of getting out of bed and not feeling so cruddy, anything is better than nothing. And if you go online and step 1, how to lose weight, you're going to see 1,000 people with 1,000 products to sell you and 1,000 programs to sell you, and having 1,000 different opinions on how to start. And it can be really intimidating and overwhelming for the average, grandmother that barely knows how to use the computer, and then they finally figure out how to use it. Now they look and they think, what is this? Yep. And the over-analysis and over-explanation of simple tasks, like you said, simply going outside and going for a walk, and starting with that, and starting with learning how to get up and out of a chair, how to hinge your hips in a chair, how to, and you see them here. I saw them here when I was working with you, but how simple it can be. and how we kind of tend to overcomplicate it. And you're a professional, and you have a doctor's degree in physical therapy, and you're a CSCS, and you have all this experiences, and
Here I am trying to tell you, like, you just need to learn how to sit up from a chair and go touch grass, and I guarantee you're going to get better.
Yes, exactly. And that's my point, is that you are as qualified as anyone to answer these questions, and you are, for the questions I'm asking, you're almost overqualified to answer them, right? And you go online and you look at some average guy average guy sounds like I'm demeaning him, but it's from any guy on social media.
Unknown credibility,
unknown credibility that maybe isn't qualified to talk about these things, and they'll tell you the best way to lose weight is my program, or the best way to get strong is 7 days a week, and they all have their opinions, and it's probably based off their personal experience. But for you, being that you have the academic background, you have the education, here you are saying, anything is better than nothing. Find your minimum the effective dose, the minimal effective dose, we'll say. Find the minimal effective dose for you, and start there. And that's great, because that's what I've been trying to spread. That's what I'm trying to say. And it can be, for me, as someone who, I'm confident in my education, I'm confident in my teaching when I teach people, and I do it for a living right now. And I still get intimidated whenever I say something like, anything's better than nothing, don't overanalyze it, start with 20 minutes once a day, or start with 20 minutes once a week. And then I go online and I'm seeing people say, oh, you're not doing enough, you're not going hard enough, you need to do this, this, and that. And I'm like, oh, maybe I'm not right. And it is very refreshing to hear you say that, is my point.
And the thing that I always tell my client, that when I was telling my clients or telling my patients is, I'm like, what's your rush? And then they go, I didn't think about that. And so I tell them, if you have no timeline for these things you're telling me, why are you in such a rush to learn all these things, apply all these things? And that gives them a lot of clarity. We know the steps are A, B, C, D, E, but our clients don't. They just see A to E. And our job, personal training, physical therapy, is to show them all the steps in between B, C, D, E, and show them that it's okay to take time for each step. If someone is a professional athlete, sure, there's a timeline. Okay, we're teams playoff bound. I need to be as healthy as possible so that way I can contribute to my team during the playoffs. Totally understandable. But everyday person, what's the rush? And a lot of people don't like hearing that either, because they will, again, the instant gratification, or just society has put performance, physique, appearance, confidence, all those things on a pedestal, and tells people how they should view those things, when really it's clients and patients should be creating that image for themselves of what those things look like. They need to create their own pedestal, not what someone else tells them to do. And the ones that are willing to buy into it and understand that are the ones that I've seen had the greatest improvements in performance, had the greatest outcomes in physical therapy. The ones that are so attached to what other people have told them to think are the ones that never get better or are never satisfied. Because they have no control over themselves.
That's very true. And the saying that you were referencing, I use something similar, but I'll tell people, if you're planning to do this for the rest of your life, what is the problem with starting, at ground zero, right? If your goal is to get to level 100, but right now you're level 0. And if your goal is to come to the gym for the rest of your life, or your goal is to do jiu-jitsu for the rest of your life, what is slowing down right now, making sure you're doing it right? What is that going to hurt, right? It's only going to solidify your foundation even more. So that's a great point. But as we wind down, I don't want to keep you for too long. I know you have somewhere to be. Again, thank you for doing this. I really appreciate it.
Of course, this is fun. Love doing these kinds of things.
I love talking to you any chance I get. And as a gift to you, And I wanted, obviously, as a thank you for doing this, but then as a thank you for being helpful as I worked here. And you were one of the more helpful people that I was around here. And not to say that nobody else helped me, but you were very, you kind of went out of your way to be educational with a lot of the stuff. You answered any question I had, whether it was related to this or related to career-wise or a certain training modality, explanation for, exercise selection, whatever it was. You did a very good job of helping me out with that, and you did that. Kind of is going to go a long way for me in how I approach my career as a physical therapist and my career right now as a trainer.
Yeah.
So thank you for that.
Of course.
But I meant to have my bag over here so I could pull it out, but I got something for you over there.
Okay.
I know you're a big coffee guy.
Oh my gosh. You know me so well.
I know you're a big coffee guy. And I don't know if you remember me telling you this, but I used to be a barista when I was in my undergrad.
Yeah.
And those are the people I worked for.
Oh my gosh, this is awesome. Thank you so much.
They have one location in Kerrville, and I went to school at China, which is in Kerrville, and so they're right next to the campus, so I worked there.
How awesome.
And that's the standard drip coffee that they use. It's whole bean. I don't know if you have a grinder.
Yes, I do.
I assumed you did.
Oh yeah, of course.
Yeah, I kind of knew you did. I figured. But yeah, I know you're a big coffee guy, and it's Blue Run. That's like an organic coffee. It's as clean as it gets.
Yeah.
They do a pretty good job with a lot of their stuff, so I figured you might want to give it a
amazing.
try.
Thank you so much. I appreciate it. Thank you. Thank you.
But again, Dr. San Miguel, thank you so much.
Of course.
I really
Appreciate you having me.
doing this.
Always a pleasure. And just a little self-plug, I guess.
Oh, yes.
So here in San Antonio, Texas, I work for an outpatient orthopedic clinic, Promotion Physical Therapy. We're one of the last mom-and-pop bastions of physical therapy in San Antonio. I particularly work at our medical center clinic, but we have 5 located throughout San Antonio. If you're ever interested in coming in, checking us out, by all means, come to our website or stop into one of the clinics.
Yes. And as someone who worked here, and I am no longer tied to the place directly, so I'm not obligated to say anything great, but they do a really good job. I've been in a number of clinics in San Antonio, in South Texas, where I'm originally from, in the Kerrville area, inpatient, outpatient, and Promotion Physical Therapy. As an outpatient clinic, and I compare it to other outpatient clinics I've been in, is one of the better ones, if not the best one I've been in. Specifically this location, I really enjoyed the med center location. You do a really good job of, sometimes in outpatient clinics you can kind of fall into like the mill style where it's kind of just churning patients in and out, and there's not a lot of attention to the patient. And I think you guys here do a very good job of not letting that happen.
Thank you.
Right?
That's the whole idea. So glad to hear it.
Yeah, and you do an especially good job of using your knowledge, not just what they tell you to do here or what they encourage you to do here. And I know whether it's with exercise selection or whatever, you use a lot of your knowledge from your other backgrounds, whether it was as a trainer, as a CSCS, and then your physical therapy knowledge. But again, here at this is Promotion Physical Therapy at the medical center location. So if anyone who's interested in working with you or unfortunately gets injured, or maybe they want to correct some kind of improper balance, any type of negative movement pattern, come see Dr. San Miguel here at Promotion Physical Therapy.
Appreciate it. Thanks.
Yes, sir. Thank you.